Hi, everyone, and thank you for joining us for part 2 of Suicide Prevention for School Staff. My name is Martha Montgomery, and I work as the School Psychology Specialist with the Office of Student Services at the Department of Education. And I'm joined by my colleague in the department and at the Virginia Center for School and Campus Safety. You are in part 2 of a 2-part series, and if you are just joining this, we encourage you to go back to part 1, where we talk about more of the prevention piece in suicide prevention. Today, we are going to talk more about intervening in a suicidal situation. So we'll talk about suicide risk assessment, including reentry plans, how to identify the mental health resources that are available within your community and in your building, and then also developing that understanding of cultivating that climate where connections between students and adults who are approachable and trusted can help build those protective factors. All right, so let's talk about the suicide risk assessment and reentry process. When a student is referred for a suicidal threat, could you advance the slide, please, Sarah? Thank you. So we want to make sure that of utmost importance is that we keep the student supervised and safe. And that person should be identified early and should continue to monitor the student. The student should be escorted to a trusted individual and supervised. The student should not be left alone for any reason. And even if something occurs at the end of the day, we need to make sure that the student doesn't leave school unattended. So part of the intervention process is determining the level of risk. And this is led by your mental health support personnel within the school building or the school division. And when we're determining the risk, it's really determining at what level do we identify the student as being at risk for suicide. And at any levels of these risks, there might be a need for some type of intervention, but that intervention might depend on which level of risk we're identifying. So none is when the student really has no thoughts of suicide, and maybe somebody overheard a comment and they were concerned, so it was brought to you, but maybe it was taken out of context and it really resulted in no risk of assessment of suicide. A low risk is when a student does have some suicidal thoughts, but they really don't have a plan established yet to act on those thoughts. The moderate risk and highest level of risk are the ones that we take most seriously. And these are when students have suicidal thoughts and at least some thoughts of a suicidal plan. The highest level are for those with a suicidal risk, suicidal thoughts, a history of self-harm, and also just unbearable pain. They're identifying that there is just really no reason for living.
Something else I'll add is, these levels are not necessarily something you share with caregivers or parents. It's not really a diagnostic tool. It's more of a tool that you use to drive your next action. It helps to create sort of an organization system for how you develop and assign interventions, or what are the things that occur naturally after deciding the level of risk. It's always best, if you're not sure if it's low or moderate, to always go with the higher end. And every division might do this differently. So some school divisions might just have simply no risk or risk. Others might not have moderate and just go from high to imminent. So it's per your division policy, but it's really important for us to recognize that this is not something that's diagnostic. It's really just a way to organize your next steps and think about what is appropriate with moving forward with supporting the student.
Thank you. Yeah, great points. So when we're looking at our suicide risk assessment, we want to look at a lot of factors. We want to look at, are there risk factors that are identified that are creating the suicidal risk? What are the warning signs that we're seeing? What is the student saying? What are people hearing? What are they writing? What are they conveying in thoughts, words, or behaviors? And also, the piece of that that's really important as well is, what are their protective factors? Do they have established social groups? Do they have a good relationship with family, with faith, with other groups? And so those are important factors because they can be really crucial in our intervention phase. When we think about the suicide risk, we really want to look at how frequent the student is having those thoughts, how long they've been having those thoughts, how intense those thoughts are, how far has that really taken them, and what is their intention? Are they talking about plans beyond today? Or are they really focused on the here and now and how I can end this pain? We also really want to consider, have they developed a plan? Are they articulating when this is going to happen, what method they're going to use, and how they're going to go about doing it? So sometimes we might hear from a student, I know that my parents don't come home until 5 o'clock. That gives me a window of 4 to 5. So we really need to pay attention to what we hear from our students in terms of communicating what their plans are. Some other important risk factors that we really need to consider when we're doing our suicide risk assessment is there a history of self-harm? And are there previous attempts? And we do know that suicide risk is higher in these populations of students that do have these histories. So we really need to pay close attention to those students. Another important piece in the suicide risk assessment is that teacher and staff interview. As some of you all might be really aware, in cases, it's a lot of putting pieces together. And sometimes those pieces don't always come together until after an event occurs. So it's really important to get an idea what teachers and staff are hearing. What is their knowledge of the suicidal threat? Have they heard other talk about it? Have other students said something? Are they aware of any issues or problems in the student's life? What are their academics looking like? How about their peer relationships? And do they know, sometimes teachers or even administrators might be aware that there might be a, a criminal case going on or something that might also be more of a risk factor for that particular student. We also really want to get a gauge on what the student's mood is. What has it been? Has it changed? Has the student expressed hopelessness, despair? And how does the student respond behaviorally? What's the student's conduct like? How do they respond to that correction as well? And we want to know, has there been anything in the student's writings, drawings, class projects, interactions that would give pause to have a concern for the student? We also want to look at student involvement. Sometimes you might see a drop off. They might have been really active in extracurricular activities, and maybe something's changed and they're not as active with those social groups. And then also, what is the relationship with the parents? Does the teacher have a strong relationship with the parents so they can go to the parents with concerns? So these are some pieces that are really important to consider when we're doing those risk assessments. So when we talk about returning to learn, this is regarding students that may have had suicidal risk, and perhaps they've been out of school either because they've received some treatments or intervention out of school, or maybe they did actually have an attempt, but they are physically okay now and they're returning to school. So we need to not pretend that something didn't happen. This was a significant event for this student. So we need to make sure that we're transitioning them back to school as safely as possible. The safety is the number one concern, because just because that student receives some type of intervention doesn't mean the risk has gone away. In fact, we do know that when students have had suicidal thoughts or suicidal attempts, that puts them at greater risk for suicide in the future. So we need to pay attention to that student safety. When we look at the transition back, we know they missed academics. We know they've missed schoolwork. So those could potentially be additional stressors. And so we need to try to mitigate some of those stressful situations and work with the student and the family in order to ease that transition for the student. We also need to really closely monitor what's happening. When we talked about the issues that we want to consider with teachers in interviews, those need to be continually monitored. If the student comes back with a different attitude, with a positive attitude, but then you see a change, then that really needs to be reported to your school-based mental health folks. Part of that returning to learn process is collaboration. We want to collaborate with our school counselors, our administrators, the family especially, and any outside mental health supports. If the student was outside receiving some type of intervention or treatment, we really want to have that close collaboration with those mental health providers so we know how to support the student best when they come back to school. And we do always maintain confidentiality. This is not multiple people contacting the mental health providers. We typically want to have one person in the building that's having that communication with the outside provider.
Martha, I'm so glad you mentioned the work and when students return and makeup work that they might have and content that they may have missed. And I think what you said about student safety being the number one priority really rings true there. Sorry, my dog has her squeaky toy, so I apologize if you hear that in the background. But I think that sometimes we need to look and see what could actually be removed from that work pile. Perhaps there's some assignments that could just be simply excused. If we do have a lot of work the student needs to make up. I know I've worked with teachers before about not giving that all to the student at once, perhaps chunking it or looking at this is what I need you to do, before the grade period ends. And then these are some other assignments that we'll figure out when we'll get them done at some point this school year. But really making sure that we're not overwhelming the student, especially if you're a secondary teacher, knowing that you're not the only teacher that is assigning makeup work. So maybe working with the other teachers that are also on that student's schedule to just make sure that you're not overwhelming them with a lot when they first return. It might even be appropriate to not assign any makeup work until later on. So that is such a huge issue. So many students, when they return, I know that when I worked with them, that was one of their major stressors, major concerns was I'm just going to have so much makeup work that I need to do. And even though, it might not have been that academics were part of what, led the student to be stressed at the beginning of this, if any stressor could be a trigger for a student. So we just need to be really cognizant of that. And like Martha said, recognizing that the student's safety is our number one priority. And then academics certainly is important, but we need to make sure that is in that second place and it's a distant second. So thank you, Martha, for touching on that, because I know that's a huge piece of that return to learn.
Absolutely. And I also wanted to point out with the confidentiality, sometimes it's really confusing on what information others can share with us and the information that we can share with others outside of the school building. So I wanted to highlight one of our resources that is on our VDOE suicide prevention webpage that's linked at the end of this presentation, our HIPAA-FERPA sharing guide. And that gives some parameters around what information can be shared with parental consent and without parental consent. So typically most staff would not be having to make those contacts with outside agencies, but for those who do, it's a really important guide to consider when you're looking at that information. So when we support that student to learn, again, the goal is eventually for that student to return to normalcy. Um, all teachers, and as Sarah pointed out, particularly in the secondary schools where the student has multiple teachers, we know that if there's a reentry meeting, not all teachers are going to be able to attend the meeting. It's very difficult to find a time that works for everyone. So if you aren't in attendance at the meeting, touch base with the student's other teachers, the school counselor, or an administrator to determine what the plan is for that particular student. And again, we really want to prioritize um, really important makeup work, but then also excuse them from unnecessary assignments. As Sarah had mentioned, the student is really dealing with a lot, and they often feel that they're somewhat behind the eight ball. So they're coming back into a place of not feeling great. And then to have this added stressor of all this additional work on top is can be overwhelming. So just be really mindful of that. And then another crucial piece is, we don't want to ostracize the students. And sometimes students, if their seat is moved, if they're identified in some way, it really can be embarrassing to the students. So unless it's requested by the student or it's part of that plan for reentry, don't move their seat. Try to keep it as trying to be as normal as possible. And then again, monitoring means keeping an eye on the student, but not treating them differently, not asking a lot of questions. If you have an established relationship with a student, you certainly can talk to them as you would have before the situation, but you don't want to be overbearing and be respectful of their privacy.
And so one of the biggest questions that kiddos have or fears they have when they're coming back is, what do I tell people if they ask why I've been absent? And so a lot of times in the reentry meeting, we'll talk about this and we'll figure out what are we going to say? What is the response that you feel comfortable with? Some kiddos, select what they want to say. I was in the hospital, or I was sick, or I needed some time to work on whatever they might want to say. But you help them come up with the way that they want to respond to that question. And sometimes it's giving them a bunch of different options of ways that they can respond. And then what's great is if that's shared with the teachers, then teachers are able to say and respond the same way should a student ask them why the student was out. Or if they ask in a public setting, maybe in front of the entire class, then the teacher can respond on behalf of the student using that scripted response. But that is oftentimes something that can trip up teachers as well as students, is when they're asked. And sometimes it's a very, empathetic question. The students are really concerned. They want to know what's going on. So having something like that already worked out can help us to not get put in a tight spot, either the student or the teachers.
Thank you. Yes. And I am going to turn it over to my colleague, Betsy Bell.
All right. Hi. Thank you so much, Martha. So if a student expresses to you that they are having any suicidal ideation or it's in their writing, or maybe there's something in their artwork, or maybe there's some other sign that Martha talked about a little bit a moment ago. So then as a staff member in your school, as a teacher, what do you do next? Well, your next stop would be one of the school-based mental health providers. Martha and Sarah touched on the different levels of severity that we look at: the none, the low, the moderate, and then the high and imminent. It is the school-based mental health providers that are actually going to make that determination. School psychologists, school counselors, social workers, and nurses are all trained in suicide risk assessment. So they're the ones who will make the assessment and determine what level of risk the student is in, and then take action from that point. If one of these folks is not available, administrator would probably be where you would go next, and then they will find one of the mental health providers for you or get one from another school. And then you can also look at, there's a link here, and it's also on the VDOE webpage, and it'll also be linked on the Virginia Center for School and Campus Mental Health page, the role of teachers in suicide prevention, and also the role of school administrators and crisis teams in suicide prevention. So if you ever have any questions, those are good resources. But it's also important to remember, never wait until the end of the day. Notify one of your school-based mental health providers as soon as you possibly can when you have a concern about a student. So other resources where you can find more information, the Virginia Department of Health has a campaign called Recognize, Talk, Act. You may have heard some of their public service announcements on the radio or on television or even through social media. And they have a ton of resource guides and toolkits and materials for schools as well as for families. And so that is a good place to go. And if families ask for information, that's also a good resource for them. The VDOE Suicide Prevention Resource, please go to their page, and the VDOE has a lot of great information, including the new suicide prevention guidelines. And then the Department of Behavioral Health and Developmental Services Suicide Prevention also has a lot of information, and it'll link you to your local community services boards, and they offer free prevention training. They also offer sliding scale services for students and their families. And all of these will also be linked on the VDOE suicide prevention page, and as well as the Virginia Center for School and Campus Safety mental health page. And then some of the other resources that are available that are more community resources and specific and quicker help for a student. The suicide prevention lifeline is so important and should be posted everywhere it possibly can. It's typically posted in counseling offices, school psychology offices, the nurse's office, but it can certainly, please post it in your classrooms as well, so that students know that this is a place that they can turn when they need help. So this is a 800 number that they can call any time of day. There's also a website that has a live chat that they can go to. So the National Suicide Prevention Lifeline is a fantastic resource. The American Foundation for Suicide Prevention has a lot of information as well. And it also has information on the text line. You can see that there, the 741-741, where students can text. And then there's also some community warm lines where when there's just a concern and you need to reach out, and those are often posted on the American Foundation for Suicide Prevention page as well under specific states. At SAMHSA Treatment Locator, you can find community resources for counseling services. The Suicide Prevention Resource Directory has a ton of counseling services and other services in the community. And then Unite Virginia is a new platform that is a one-stop shop for for services for students, everything from suicide prevention to after-school childcare. And so that's a great platform as well to look, and you can look by category to find information on services in your area. And again, these are all linked. I know for certain on the Virginia Center for School and Campus Safety mental health page, you'll be able to find these. And I believe they're probably also linked on the VDOE page, but Martha or Sarah can speak more to that. So thank you. And at this time, I'm going to turn it over to Sarah, who is going to talk about the importance of a climate and connection.
Thank you so much, Betsy. So to kind of wrap up our training, we really want to touch on probably one of the most important elements of suicide prevention, which is creating a climate in your classroom or in your school where there is trust between adults and students feel like the adults that they interact with are approachable and supportive. So that sounds simple, but it isn't. As we all know, support is in feeling supported and feeling like you can trust someone takes work, and it has to be intentional work. And so there are lots and lots of ways to cultivate a positive school climate. But that really, what it boils down to is those student-teacher relationships and making sure that we are intentionally, actively, every day, taking time to prioritize building relationships with students. Because if we are doing that, if a student starts to struggle, they are hopefully going to feel more comfortable coming to an adult that they interact with regularly to let them know that something is going on. Maybe they feel like they can open up to that teacher that they, see so often. A lot of times for students, it is easier to open up to a teacher than it is to a family member. And that's not because the parents or the caregivers are not supportive and wonderful people, but a lot of times they feel like their teachers are going to be able to respond in a less emotional or maybe in a more supportive way than they can their family members, or they might have this fear of really hurting or scaring their parents or their caregivers. So we often hear that the teachers are one of the most often reported places where students report feelings of suicide. And if a student does come to you or does express that to you, or maybe a friend of a student comes to you, then that truly is because you have taken the time to build that positive relationship. So it's just such an important piece of that preventative measure that we have to really look at and take some tangible steps towards building. There are lots of ways, like I said, to do this. And it's important that you find ways that are genuinely authentic to you. So for example, there's those teachers that do those like high five greetings as students are walking in the room. If that's not you, don't try to do that. It has to be something that aligns with your personality, your teaching style. Otherwise, it's not genuine, and students are always going to smell that out. So look at different ways to cultivate positive relationships with students. There's tons out there, and find one that really, aligns with the teacher that you are and your personality type, and something that you're going to feel comfortable with. Class meetings are an example of this. There's so much research, so many different resources out there around that. But having those regular class meetings builds community in your classroom, and also gives you a chance to learn about students outside of school and some of the things that they might be facing. It's really important that we value student voice. The Save the Last Word for me is just an activity that is an easy way that you can incorporate student voice into your lessons. And then there's the Valuing Student Voice link here that just has some additional strategies. But I think the more we can find just simple techniques, strategies, routines, systems that we can embed regularly into our classroom, the better this is going to be. Students really crave those routines that happen regularly, so they know it's coming, they know to expect it, and it's just something that then fits. And a lot of times, as a former teacher, I know that we're strapped for time, and it might be tempting to cut that morning meeting, or instead of doing your whiteboard activity about a quote or about self-care, you decide that you need to do that math review instead. But I really encourage us to prioritize this stuff over the academics, because it really is so important. And when we prioritize student relationships, we know that as a result, the outcomes are great in not only academic performance, but also with things like suicide prevention. So we know that it's not always easy to have a conversation about mental health with students, but the more we do it, the less that we really eliminate the stigma by having these conversations. But sometimes we're not sure how to do that. And so I love this graphic. I think it really breaks down some of the do's and don'ts around having these conversations. And I think it's a great reminder. I'm not going to read it to you, but I encourage you to take a moment to look at it, kind of think about what this would mean in your classroom, and it's possibly even printing it off and having it somewhere that you can reference. I think one of the biggest ones is not interrupting the student, making sure that we're listening, making sure that if we are going to approach a student, that we do so when we have the time to listen, and we do it in a private setting, which we talked about in the first webinar as well. But don't ask if you don't have time to listen. So if you're going to approach a student and ask how they're doing, or ask about what's going on, or try to have that conversation around mental health, make sure that you do it in a time and in a place when you're going to be able to give them your undivided attention. And again, we were talking about cultivating those positive student relationships. It's also important that if you're to do that, you have to make sure that you're taking care of yourself as an educator. We have to make sure that we are inviting students into our controlled, calm space, and that we're not getting pulled into, maybe if they're out of control or feeling not regulated. We don't want to be pulled into that. We want to pull them into our calmness. And the best way to do that is to take care of yourself as an educator, recognize your stress level, recognize your emotional needs, and to take active steps to make sure that you're staying regulated. These wellness checks for educators are a great resource, as well as Headspace. And as an educator, you can access the Headspace app for free, and it has some great resources for your classroom as well. It's also really important that we model vulnerability and honesty. Students truly appreciate when we as adults show them that things are hard for us, or maybe that we're struggling with something, owning up to a mistake, or saying, you know what, I was really afraid when this happened, or I was really scared, or I was really stressed, or this is confusing for me too. When we name our feelings, both positive and negative ones, or comfortable or uncomfortable ones, students start to learn that that's okay, that's normal, and they might actually start picking up on some of those habits. So not being afraid as a teacher to put yourself out there and to say, this is how I'm feeling right now, or this is the way that I felt when this happened, can really be a powerful thing that we can do for students. And then also finding ways that you can connect with students one-on-one. Recognizing those opportunities where you can embed a routine or a system where you can have even 2-minute conversations with students on a regular basis, one-on-one, is so important, and something that a lot of times kiddos don't get is that one-on-one adult attention. And then this is a simple one, but it's such an important one. And there's so much research behind it. Is instead of standing over students when we're talking to them, if you go up to a student's desk or you're having a conversation with them, either pulling up a chair beside them or kneeling down, so that you're eye to eye with them, as opposed to standing over them. There's so much to that simple act that sends a message of caring. It sends a message of, I'm here for you, I'm here to support you, instead of that authoritative or punitive or kind of overbearing approach of standing over a student and talking down to them. And then taking every opportunity you can to model kindness. Don't be afraid to laugh in front of your kids and smile as often as you can, and to just show them that you're a human being and that you care about them as much as possible. All right, so we are at the end of our series, and so we hope that everything that has been shared has been helpful for you. We know it's a lot of information and it can be somewhat overwhelming, so we encourage you to go back and to either go through the slide deck or rewatch the webinars if you feel like you need a refresher. But if you feel like you are ready, there is a quiz that you can take to receive your certificate. I will say that if you get a question wrong, it is going to prompt you to start the quiz again. So it is looking for that 100% accuracy. So if you do not feel like you're ready, please, again, that's the great thing about recorded webinars, is that you can watch it again. But when you do feel ready, you can take the quiz by either going to the website that you see here or using the QR code and scanning that. And then there's, again, additional resources if you feel like you want to learn more on our VDOE suicide prevention website, as well as the Virginia Center for School and Campus Safety website. So we encourage you to check those out as well. But we really appreciate your time and energy and all that you're doing to prevent suicide in your classroom and in your schools. It is a shared responsibility of all of us, and something that I hope that we take intentional acts and intentional steps forward into doing, not just at the beginning of the school year, but throughout the year, because it's just such an important thing that we can do as educators and as adults in students' lives. So thank you so much. Betsy and Martha, did you want to say anything else before we sign off?
No, thank you so much for participating in this webinar series so that you have this information.
All right, everyone.
Thank you.
Thanks so much, and take care.